Have you ever noticed yourself waking up several times a night just to use the bathroom? Or maybe during the day, you feel like you're never far from the toilet, always looking for the next chance to go. For many men, these symptoms are more than just an inconvenience. They are closely linked to prostate health. The prostate is a small gland, but when it starts to change with age, it can have a big impact on how you urinate. Frequent trips to the bathroom, weak urine flow, or the feeling that your bladder never empties. These are all signs that something may be going on with your prostate. In today's video, we'll look at frequent urination from a urologist's perspective, explore how prostate problems can be at the root of these symptoms, and explain the steps you can take to protect your health and quality of life. The prostate may be small, about the size of a walnut, but it plays an outsized role in men's health. Located just beneath the bladder, the prostate surrounds the urethra, the tube that carries urine out of the body. Because of this position, any changes in the prostate can directly affect how easily and how often a man urinates. As men age, the prostate naturally grows. For some, this growth is mild and causes little disruption. But for many others, the prostate becomes enlarged enough to squeeze the urethra. This condition, known as benign prostatic hyperplasia, BPH, is extremely common in men over 50. While BPH is not cancer, it can make urination frustrating, causing frequent urges, weak stream, or that constant feeling of not being able to empty the bladder completely. Beyond BPH, prostate health matters because the same symptoms can also be linked to more serious conditions. Prostatitis, or inflammation of the prostate, may cause pain, burning, or urgent trips to the bathroom. And while less common, prostate cancer can mimic the symptoms of BPH in its early stages. That's why men should never assume frequent urination is just part of getting older. From a urologist's perspective, prostate symptoms are like a warning signal. They don't always point to something dangerous, but they always deserve attention. Ignoring them can lead to worsening bladder function, kidney problems, or in rare cases, missed detection of cancer. Prostate health is central to urinary health, and addressing problems early is the best way to protect quality of life in the long run. From a urologist's perspective, frequent urination is never just a random nuisance. It's a symptom of a story behind it. When a man comes into the clinic complaining of waking up multiple times a night or running to the bathroom too often during the day, the urologist starts by looking for patterns. They want to know, how long has this been happening? Does it occur more at night or throughout the day? Is the flow weak, or does it stop and start? These details help separate harmless habits from deeper medical issues. The evaluation usually begins with a conversation, followed by a prostate exam and a set of targeted tests. Urologists may order a urine test to rule out infection, a PSA blood test to screen for prostate cancer risk, and an ultrasound to measure the bladder and prostate size. They may also use a test called uroflowmetry to measure how strongly urine flows, which helps detect blockage from an enlarged prostate. From the urologist's point of view, frequent urination is like a warning light on a car's dashboard. It doesn't tell you exactly what the problem is, but it signals that something in the system needs attention. Sometimes the cause is as simple as drinking too much caffeine in the evening. Other times it may be a sign of benign prostatic hyperplasia, BPH, prostatitis, or in rare cases, prostate cancer. The key is that a urologist doesn't guess, they investigate. By combining your history, exam findings, and test results, they can build a clear picture of what's really happening and guide you to the right treatment before the problem becomes worse. When it comes to frequent urination in men, prostate-related issues are among the most common culprits. The most widespread condition is benign prostatic hyperplasia, BPH, or prostate enlargement. As the prostate grows, it compresses the urethra, making it harder for urine to flow freely. This leads to symptoms like a weak stream, hesitancy, dribbling, and the need to urinate more often, especially at night. BPH is not cancer, but it can significantly affect quality of life if left untreated. Another frequent issue is prostatitis, which is inflammation or infection of the prostate. Prostatitis can cause painful urination, burning, pelvic discomfort, and sometimes fever. It often comes with urgency and frequency, making men feel like they constantly need to find a bathroom. While infections are often treated with antibiotics, Chronic inflammation may require longer-term management. Although less common, prostate cancer must always be considered. In its early stages, prostate cancer can mimic the symptoms of BPH, such as frequent urination or difficulty emptying the bladder. That's why urologists often order PSA blood tests and conduct prostate exams when evaluating urinary problems. Early detection is critical because prostate cancer has a much better prognosis when caught before it spreads. Sometimes frequent urination is caused by a combination of factors: an enlarged prostate combined with overactive bladder muscles, or inflammation paired with lifestyle triggers like caffeine or alcohol. From a urologist's perspective, the goal is to carefully sort through these possibilities, ruling out cancer, addressing infections, and treating enlargement, so that patients not only find relief from their symptoms, but also gain peace of mind about their long-term health. Once a urologist has identified the cause of frequent urination, the next step is treatment. The good news is that prostate-related urinary problems are highly manageable, especially when addressed early. For men with benign prostatic hyperplasia, BPH, the first line of treatment often includes medications. Alpha blockers help relax the muscles around the prostate and bladder neck, making it easier to urinate. 5-alpha reductase inhibitors can shrink the prostate over time, reducing pressure on the urethra. In cases where medications are not enough, minimally invasive procedures such as laser therapy, urolift, or even surgery may be recommended to restore urine flow and improve quality of life. If the problem is prostatitis, antibiotics and anti-inflammatory medications are usually prescribed. Chronic prostatitis may require longer-term therapy, including pain management and lifestyle modifications. For men diagnosed with prostate cancer, treatment depends on the stage. It may involve active surveillance for slow-growing cancers or more aggressive treatments like surgery, radiation, or hormone therapy. The key is that early detection allows for more options and better outcomes. Lifestyle changes also make a big difference. Reducing caffeine and alcohol can decrease bladder irritation. Cutting back on evening fluids helps reduce nighttime trips. Maintaining a healthy weight and exercising regularly support better bladder control. Pelvic floor exercises, often called Kegels, strengthen the muscles that help regulate urination. Even simple habits like scheduling bathroom visits to train the bladder can provide relief. A urologist's role is to combine medical treatment with practical lifestyle advice, creating a plan tailored to each patient. This approach not only relieves symptoms, but also protects long-term prostate and urinary health. Frequent urination isn't just about inconvenience. It's often a signal that your prostate health needs attention. Whether it's BPH, prostatitis, or in rare cases prostate cancer, the key is early evaluation. From a urologist's perspective, these symptoms are like warning lights on your body's dashboard. Ignoring them likely risks complications, while acting early opens the door to effective, often simple treatments. The good news is that with proper care, most men experience major improvements: better sleep, stronger energy, and renewed confidence. Protecting your prostate health means protecting your overall quality of life. So if you're waking up too often at night, struggling with weak flow, or feeling like your bladder never empties, don't ignore it. Take action, schedule a urologist appointment, and take control of your health today. If you found this video helpful, please like, share it with someone who needs it, and subscribe for more trusted health insights.